but a clinical officer does clinical medicine, so we treat basically. I work like a doctor. It's a course which is mainly in Africa because not so many people make it to the university to do medicine. So they found, yet the need to treat is really big. So many people are sick and we don't have so many doctors down here. So they put a course of clinical medicine where you go and do it for 3 years so you can go and treat and help people in the villages. So that's what I did. Very poor children, needy and orphans. They come with so many conditions, but mainly, usually it's malaria. Yeah, malaria is the main thing, and then respiratory tract infections, and then worms, jiggers, wounds, and so many others. Usually the schools and the villages we go to, we have given them particular days. So when we get there, they already expect us. Like, if a child or a school knows that it's a Tuesday and it's their day, they expect me. So when they see a car, they know where I sit. Usually it's the staff room. And then whoever is not feeling well, at times I find them waiting for me. And then some of them, when they see the car, then they just come to me. Only that usually it's just the kids alone without parents because they come from so far from all over. They walk so many miles from the villages to the schools. So when I'm treating, it's just the child and me. And at times it's a bit difficult, especially if it's really the very young ones, like 5 years, 4 years, when they have been sick with malaria. And then at times they are not sure for how long they have been sick, and then they are not sure of exactly how they feel. So it makes it a bit tricky for me. Yeah, but eventually when I talk to them and then I do a malaria test and everything, I can get to know what the problem is. And then maybe another challenge is also with treating, because it's a bit hard to give treatment to a young child of 5 years and then directing them, because by the time they get home, they have already forgotten. So we have invented something of child-to-child care. It's so common. It's usual that a child like 5 years has an older sibling, maybe in another grade, maybe 11 years and 12 years. So I usually call the older sibling, the older brother or sister, and then I tell them how this child should take treatment. And then if a child doesn't have a sibling, then we can use a teacher. And it has really worked. We usually get volunteers from Sweden, from Denmark, and then we also get volunteer nurses from the hospitals in town, government hospitals. They come and help once in a while.
What does a volunteer do when they go out with you? I saw Daniel out there the other day. What was Daniel doing?
Daniel applies creams to, like, if a child has a skin infection, he can just clean the child and then put a cream. If it's a wound, he can also help to clean a wound and then cover it, dress the wound.
How old is Daniel?
Daniel is 17 years old.
So you can use help from a volunteer 17-year-old to go out and treat these children?
Yes. Anyone can be of help. Yeah, Daniel is 17 years old and he's really doing a great work out there. He's helping so many kids, he's applying so many creams to so many children, and then, yeah.
And I noticed he also measures out the prescriptions.
Yes, yes. As I examine a child, though, what he gets out the pills, he counts. Maybe if a child is supposed to take 1 pill times 3 for 5 days, he just counts and then packs it, and then he gives it to the child. I'm just encouraging anyone who would want to help. There is really a big need down here. Currently, I'm working alone in the Uganda Child Care, and I'm treating thousands of people, so many out there in the villages. There are no hospitals. People walk for miles to get to the hospital, and at times there is even no medicine. So any help, anyone who can volunteer, anyone can do anything. You don't have to have gone to a medical school to do. You can apply a cream. Anyone can clean a wound. The need is really big.